Hi everyone, welcome. It's the Fly Foot Doctor. So today I'm going to be talking about something more medical than something that is very relevant to what's going on currently. So as we all know, COVID-19 is what's been taking over the whole world. If you open any social media platform, you see that that's what's going on. It's everywhere. You know, people are dying. We're being quarantined right now because we want to make sure that we flatten the curve and do not spread this disease. Now, as a podiatrist and foot and ankle specialist, there has been some new developments that I think it will be very important to share with everyone, my colleagues in the podiatric world, my dermatologists, other doctors, as well as the public. And what it is skin lesions that are presenting in the presence of COVID-19. Particularly for me, these lesions are presenting in the foot. So, what am I talking about? I'm talking about acute ACRAL-ISCHEMIA that is presenting in patients that are diagnosed with COVID-19 or patients who have symptoms that are related to COVID-19. What does ACRAL-ISCHEMIA mean? Well, ischemia essentially means an adequate blood supply or blood flow to tissue or organ. Acral is actually a Greek word that's of Greek derivative, but we use it when we're referring to our limbs. And so for this situation, when I say ACRAL-ISCHEMIA, what I mean is the loss of blood flow or the shortage of blood flow to the digits. And as you can imagine, as a podiatrist who looks at foot and ankles all day, every day, that will be something I would need to know, because those could be warning signs for a patient if they come to the clinic for other urgent or emergent issue during this time and they have lesions that are similar to that. That will alert me. So what does that mean? So there, beginning of the year, actually maybe around like February, March, there have been studies that are starting to show that there are some lesions that are presenting in patients with COVID-19. And these acro-ischemic lesions are presenting in the foot and in the toes. And I'll put some pictures up there so you can see what they look like. These lesions, they present as red, purplish, fluid-filled blisters all over the body. They are similar to some of the blisters or the rashes that you would see in a patient with chickenpox, chilblains, or maybe even measles. The first article that has been out about this sort of rash was in a 13-year-old boy in Italy. He actually just presented with some symptoms that the doctors there thought was a spider bite. But his sister and his mom also had some respiratory symptoms, and I believe that they were already diagnosed with COVID-19. Anyways, this child presents and has these symptoms, and again, I'll show you pictures of the progression and how it's going. So we started talking about it as a podiatric community out in Spain, you know, has been talking about it and just kind of has been the one that has brought this up to light. Some New York doctors have also confirmed that there are some patients that are presenting with this acro-ischemic lesions on their body parts. Now, you have to know also that some COVID-19 patients are not only presenting with this fluid-filled, really itchy blister type rashes, there are other types of rashes that they're presenting with as well. There's this non-specific rash or viral exanthem that is presenting with some of these patients and look like livedo reticularis type presentation or petechial type presentations. The ones that have been seen in the foot and ankle are more microthrombotic lesions that are presenting again like those that were shown in the picture. Again, this is all new. We're still learning about it, but as a heads up, if you or your family member or anyone think that they may have been exposed, or if you're a physician and you're seeing patients, I think it is very imperative that you look at the foot and ankle if you have any sort of inclination or a suspicion that this patient may have COVID-19 or have been exposed to it. In some of the literature, it is saying that some of these patients present with these lesions before they start to have other symptoms like fevers, headaches, body, muscle pain, or any kind of respiratory symptom. So maybe that's something that you should look out for and then will give you a directive to go test this patient and keep them secluded and quarantined early enough so that they don't expose people. It is particularly important for people who are asymptomatic and have this lesion, because then they could really just be going about their daily activities and be passing this virus to other people. In Wuhan, China, where this virus actually started, a team of hematologists have actually gone back and done a retrospective study on patients who have passed and just kind of looked at charts and kind of seen what they presented with to kind of see if they did have some of those presentations. It showed that 7 of the patients who had passed did have that presentation. 3 of those patients had underlying disease like diabetes, coronary artery disease, and high blood pressure. And so these lesions presented again like little blisters, really itchy, rash on their limbs, their toes, and their foot. And then it proceeded to dry gangrene, similar to some of the pictures that I've posted. The average time from onset to the limb ischemia, which is when it starts to turn that reddish, purple, dry, almost like dead tissue, was average 19 days. They also did other tests that could sort of look to see if there is a hypercoagulation component to this disease. And some of the tests will be listed on here, and they saw that they did have elevated levels, which supports the fact that this virus, when it infects, it definitely does and could cause ischemia. All in all, what does this mean to you, my colleagues, as a podiatrist, or other doctors who are seeing patients, or friends and family, or just the general public? Not every patient with COVID-19 will present with rashes in the lower extremity or in the extremities in general. Typically, they will present with rashes in the trunk or in the main frame of the body. Secondly, there are lots of other viral diseases that present as rashes. So make sure that you are ruling out other possible causes of this rashes before we jump to COVID-19, especially if you've been sequestered at home on quarantine and been keeping things clean, performing your daily hand hygiene, cleaning and washing with soap and water or sanitizing. We should make sure that there are not other viral causes before we jump into COVID-19 potential reason for the rash. If you see this petechiae or purpura or these purple red-like lesions, make sure you have other differentials in mind, because again, there are other things that could potentially be causing this. So again, don't jump into conclusion. If this lesion is presenting in a child or in someone who has living with other people, make sure to ask about other people in the house. Do they have respiratory symptoms? Are they having fevers, headaches, body pains, any sort of shortness of breath or anything like that? That may help you to diagnose or to even kind of think towards COVID-19 before making an assumption. All in all, we will get through this. Let's keep the social distancing going. Let's keep the hand hygiene at utmost, washing your hands with soap and water, making sure it foams. The hotter the water, the better. And making sure that you wash for at least 20 seconds. If you're unable to wash, then use your hand sanitizer or alcohol and then moisturize. All in all, please stay safe, guys. Thank you for sticking with me to this video. Have a good day.